I'm Dr. Michael Miyasaki, and it's really nice to be here with you again. One of the things that I really like about doing these little programs is that it's like you and I are just together. How many times have you wished you had somebody you could talk to, be honest with, you didn't have to worry about them sharing any secrets or anything like that, but just to share ideas with of how to get ahead in this career. Being a dentist is not easy. The job's not easy, running the business is not easy, and we kind of go into it ill prepared, at least I think. But these programs help me because I have a chance to meet with you, talk with you, and I really appreciate your time. I like to intersperse some general information along with the material information that we're discussing as these programs go by. Why do I like to talk about the material and techniques is because it makes our everyday jobs easier. I was talking to a young dentist who is finding doing direct composites a challenge. There was a lot of post-curing contouring that had to be done, and it was just the way that the matrix band was being placed. There's just little things that we can change and share ideas about that can make our everyday work easier. And when our everyday work is easier and we go home, we're a lot happier. So that's what I hope these programs are doing. But what I wanted to talk about was some of the questions that I get, and just wanted to share some of my thoughts. You're welcome to have a different opinion about things. This is just from my experience. But one of the questions I get a lot is, we like you, but you're an old dentist. What advice would you give to a new dentist or a young dentist? And I think this is probably one of the questions I really enjoy answering the most. The first thing is in dentistry is just to try to have fun. Uh, Dentistry is a great profession. It allows us to create a career any way that we want to. Hopefully, we're going to be profitable so we can do it for a long, long time. But, I have a chance to go to different dentists' office. We teach programs in other clinicians' offices. I have a chance to see how they equip their office. I have a chance to talk with those dentists. And I will tell you, I'm convinced that every dentist will find that pool of patients that really does appreciate them. I've been in some practices that are super high tech. I've been in some practices that have very little tech. I've had uh, some practices where I've gone to where the clinicians are just uh, great verbally. They look good, they smell good, and they talk good. Then I have other clinics that I've been to that are just that. They're like a clinic. Nothing about that clinic is impressive. The clinicians may or may not even communicate well. Everybody has a different set of skills, and yet those practices flourish also. So today I'm not so worried, even for myself, of developing that perfect practice, that practice that I see on maybe Instagram, thinking, wow, that's an amazing practice, and that clinician's just an amazing clinician. And when they talk, they give and share their verbal skills with us. And I think, wow, I wish I could handle every situation as well as that. But if you feel like you have any of those shortcomings, get over it. There's no area that you have to be perfect in. Patients will find you, be authentic, take good care of them, and you will do well. Dentistry affords us, I think, a very rewarding career. We have patients that come in and they have no dental needs. And my job, I view, is to keep it that way. What can I do so that they don't have to spend a lot of money on dental work, or nobody loves going to a dentist. So how do I keep them from ever having to go through a lot of work and be uncomfortable? Then we have those other patients that require a lot of work. And so when they come in, we're trying to figure out how do we best uh, handle their case to take care of them, to keep them comfortable. Sometimes we have to balance out with keeping them within their financial means. But when we're done, we give them back their happiness, their confidence. They can smile, they can speak, they can interact with others without having to worry about missing teeth or bad breath or anything like that. They are the best that they can be. They can eat better, which improves their health. They can speak better. They can smile. I mean, it really is a life-changing profession that we have and that we can enjoy. Sometimes it is doing those elective procedures, maybe straightening the teeth, maybe whitening the teeth, maybe doing some veneers, and that can change your patients' lives dramatically. I've had veneer patients where we did a set of veneers, and the patient came back a year later saying that the veneers changed their life. Not sure why, but it gave them more energy, and we thought maybe it's just the confidence that it built. But the patient said that their gums were healthier, that they had sold businesses for millions of dollars, and it was all because of the confidence that they had with their new smile. So that's where I don't want to downplay what it is that we do as dentists. We do a lot of different things every day, from counseling on prevention, uh, restoring bites that have been destroyed by clenching or grinding. We just help patients be the best and the healthiest that they can be. I think it's a very rewarding profession to have. Second, I always tell young dentists to figure out where they want to be. Don't let their careers just happen to them, because all the days go by really fast. When you think about Monday through Friday, how fast does that week go? And then you think about a month, how fast that goes. And then the years start to pile up. I never thought I would get to the point where in this profession where I had practiced almost 4 decades. To me, that's mind-boggling. And then in my mind right now, I've got a couple more decades to go. I find that dentistry is very challenging, and I enjoy the challenge that it brings. So when it comes to your vision, we all have different visions, and that's the great thing about dentistry, is that there's, like I mentioned before, no one way of practicing. So some of you are going to be associates with a senior doctor. I will tell you, if you're going to be an associate, try to be the best associate you can be. Some of you will take on a corporate role in a DSO or a more corporate type of practice. If that's where you're going to be the best dentist in that office you can be. Some of you will choose others, maybe public health, maybe prison systems, or to serve others in other capacities. I would encourage you to do it the best that you can. Keep learning. And if you keep learning, you keep increasing your skills. And by increasing your skills, you increase the value to the patients that come to see you. And I think that's critical. If you're going to be an associate, you want to increase your value by increasing your skills, because someday you may want to be the senior dentist. Or if you're going to be an associate, the more skills you have, the more revenue that you will generate, which is win-win for you and the patient. So keep learning. I think that's one of the biggest things. When I was a new graduate, my father, who was a dentist, said, as soon as I graduated, and I thought that I knew a lot, he said, "You don't know anything. Start taking CE." And again, this was almost 4 decades ago, and the advice that he gave me was take at least 100 to 200 hours of CE every year. And that's what I did. I would take time off from work, and I didn't have a lot of money, but I would find the courses I could afford, and I would take CE course after CE course to CE course. And today I have dentists that I talk with, and they go, "Well, you're a pretty smart guy." I go, "No, I'm not. It's just I've been doing this for a long time." And so over those years, you start to pick up a lot of different skills. But pick out the way that you want to practice. And again, have it be authentic to you. That's important. Third, and this is where dentistry's changed, is build your brand and learn how to market. Because let's go back to that associate example. If you're an associate and they know you, and by knowing you, you have created a brand. If you then go off and start your own practice, patients will follow you because they want you to be their dentist. Then whether you are an associate or you work in a corporate practice, things have changed as far as marketing. You could be the best dentist, and if nobody knows where you are or the services you can provide, they won't seek you out. What you need to do is you need to increase your marketing knowledge. And I know back in the day when I finished dental school, it was get out, maybe put a sign up. One more additional step was maybe a yellow page listing and then a yellow page ad. And back when I graduated, it was kind of frowned upon if you did a lot of marketing. Whereas today, everyone's marketing, whether it be your web page, your social media that you put out there, or maybe some community ads that you take out. You have to show the patients why they should see you and where they can see you. You know, where your address is, where your website is. You have to learn how to market. Some of you may want to drop insurance at some point. Well, what is insurance? Insurance is a marketing arm of your practice. Patient gets a job, they get insurance, they look up where a dentist close to their house or to their work is, they look at your reviews. That's driving patients to you. When you no longer contract with insurance companies, those patients will no longer be able to find you. And that's why you have to have your own marketing. So if you ever decide you want to get away from your insurance contracts, you need to augment that decision with some marketing. So those are just some tips I would give to the young dentist. Now, for a dentist that's been out for a while, maybe 10 years, I would ask them, well, how do you feel you're doing? You know, when you have your goals and your financial goals, perhaps, are you able to achieve everything that you need with the way you practice today? One of the things I think is an area of frustration is doctors need to make more because everything gets more expensive. Your mortgages get more expensive. Your kids get more expensive. Just the food, the clothes, maybe the college education. And when you can't provide for them, that creates a lot of stress. And I will tell you, I have started 5 practices in my career. And every time I started a practice, those first couple of years, those are years of struggle where you are not making a lot of money. And so making ends meet is tough. So if you're one of those doctors right now where you're thinking, well, I'm not making as much money as I'd like to make, then we need to figure out how you could make more money without having to work more hours. Typically it's going to be increase your skills so that you can do more high-end type of dentistry. Or maybe it's doing ortho, clear tray, like I'm wearing right now, clear tray type of ortho, maybe aesthetics, maybe implants, maybe doing root canals like we talked about in the past. When I look at my career and those struggles I was mentioning, when you have a new practice and even an established practice, it can be years of drought. I think of it as something that's good. Just be patient because it too shall pass. But I think of it like the roots of a tree. A tree that's had to survive a lot of droughts has a deeper, broader root system. And that's what we do is when we don't go to, let's say, a corporate practice, and I'm not putting corporate down. I'm just saying a lot of graduates will graduate today. They may get a sign bonus and immediate guaranteed salary. So they go off to the corporate world. Whereas if you were to start off with a private practice, you would have years of not much income. But I think what will happen is 5 years later, 10 years later, you will have a practice with a very strong foundation that will give you more security. Nobody can walk in and say, well, you're not producing enough, so we're going to let you go. You've got your own practice. And that practice, after years and years, even if those years of toil and struggle, have helped you develop deeper roots. So this deeper foundation, the patients want you. You've built your brand, you've got your marketing, you've got your goals of what you want to achieve, and now you're set really for as long as you want to practice. I think that is the goal that I'm trying to get dentists to understand is there's always pluses and minuses. And I'm not saying there's one right way to practice. I'm trying to give you tips of how to practice different ways. So being a business owner is not easy. Being a boss is not easy. Being a dentist is not easy. Techniques are changing, materials are changing. And so that's why you have to stay on the top. So that's why I hope you join us for these programs because hopefully it's kind of a painless way to stay up to date on providing the best in patient care. I think what's also important is we have to treat our patients as our families. So as we're treatment planning them, just think, what would I do for my own family? If it's a younger person, what would I do for my child? If it's somebody who's maybe same age as us, what would I do if my sibling came in? And if they're an older patient, what would I want to do for my parents or my grandparents? And I think if you keep thinking about the treatment you provide for your family, hopefully like your family, that's a good way to figure out is that treatment good or maybe not. So the third group is the doctors that are maybe my age or even older. Um, then I think what we're starting to think about is, am I where I need to be financially? Remember, everybody has a different life. It's not, you don't have to have fancy yachts and race cars and multiple homes, but you just want to make sure that you feel secure. So determine what it will take to feel secure, work towards that end goal. Then we get to a point where we have what we need, and life becomes more about what we can give to others. So try to mentor a younger dentist, not imposing the way that you practice, but again, listening to them, the way that they practice currently, what their goals are, and if there's some areas where you can help them achieve that journey faster, such as you might run into a young dentist who says, hey, I would love it if you would teach me how to do veneers the way you do veneers or place implants the way you place implants. And you can go in there and mentor that younger doctor. That's one of the reasons why I love education, because it gives me a chance to share. And when I share, sometimes clinicians will come up to me and they'll say, you know what? I have a way of doing it. And they'll tell me what that way is. And I'll hear them. And I say, you know what? I think your way is better than mine. Thank you very much, because today I learned from you. So I always try to keep an open mind, knowing that the way I do everything isn't the only way and isn't even always the best way. So we need to share ideas with our colleagues. Now, programs like these are, again, like I started off by saying at the beginning, is just a way for us to get together. I hope you enjoyed the information. If you do, hit the like button, hit subscribe so you don't miss any other programs coming up, because we're creating a community of like-minded individuals, clinicians, and colleagues that are trying to do the very best for the patients. And I know that's what you're all trying to do. And it isn't easy in every situation, but I hope to show you some clinical tips to help. So I hope this was okay. It's a non-clinical day. I just wanted to spend a little bit of time with you, getting to know you. I'm Dr. Michael Miyasaki. I've been in practice for a long, long time. And my primary job, besides taking care of my patients, because I'm still in full-time practice, is to share with you. And if you have any comments or questions ever, please put them down at the bottom. We do get some questions and we do get the answers to those questions to those who ask. But I just really enjoy being here with all of you, and I'll see you next week. Take care. Thank you very much.